So, Bismillahirrahmanirrahim. Today we are discussing a very important topic of LASA drugs, handling of LASA drugs. Look alike, sound alike. When there is a such drugs, there are chances of accidental dispensing over there. So let's see what type of these are. You can see in this picture, someone are look alike some drugs. You can see over there. Further, we can go. And there's the allopurinol over there, and there's the amitriptyline. Both are different drugs. Allopurinol, the same color is over there, same amitriptyline is written over there. Both are different generics. So further we'll go next in picture. I can show you the different type of LASA drugs. So first, we have to start from here. There come ऐसे with the medication errors. कौन-कौन सी drugs में error possible है? Drugs type है. Analgesics में sometimes there can be error हो सकते हैं analgesics. Sometimes they make over sedations due to overdose. Sometimes you have to apply wrong route of administration. Failure to monitor heart rate. Sometimes they may cause palpitation over there. Sometimes there are problems of respiration they may produce. They can fluctuation of blood pressure due to these drugs. Sometimes allergy reaction, patients with documented allergy, sometimes they could not tell, they may produce some allergic reaction with the help of drugs, analgesics. In case of antibiotics, they can overuse when symptoms do not want to use. Sometimes what the person do, that they can use themselves, they increase the dose or decrease the dose. So when sometimes they use wrong antibiotic dose or both, because antibiotic must be prescribed according to the organism. What we have to do, we have to use for empirical therapy before without culture and sensitivity test, without prescribing drugs, culture and sensitivity test the patient. That's why there are chances. So that is known as first when the patient has to come, he has some infection. The doctor has to prescribe. That is known as empirical therapy. So there are chances that sometimes patient can increase or decrease the dose. Sometimes wrong antibiotic dose or both sometimes it can be happen. So acute system is that they must have to go for culture sensitive when they are arrived in OPD or arrived to a doctor or in a hospital facility over there. After that, they has to be given antibiotic according to symptomatic. If there is a diarrhea, which type of antibacterial is mostly used. If there is another infection, they dispense according to that. So sometimes it happens that then they have to wait for the culture and sensitivity. The report has to bring. It takes 48 hours. So during that period, they have to prescribe empirical therapy. So sometimes they have to prescribe the wrong drugs, the wrong antibiotic or dose or both. So that must be checks any allergy from these drugs. Then sometimes for cardiovascular agents, sometimes overdoses can be happen over there. Anticoagulants, they can cause errors. So then what inadequate therapeutic dosing, sometimes they have to do. Then sometimes diuretics, overdose, lack of monitoring electrolytes can cause. So when there's overdose, there is a urine has to pass on. So then there can be chance of electrolyte loss. Then diabetic, use in people without diabetes, overdose of intravenous or injectable cannot be given for insulin to the patients. So diabetic person, they have to advise to take the drugs through subcutaneously. So if someone has to be taken diabetic intravenously, that can be fatal for the patients. So hyper vigilance, because it has to be. Medication has solicitation requiring hypervigilance. So that sometimes if you have wrong history, his patient has not given you proper history, there are chances of some errors. So, information, inability to monitor multiple chronic conditions if not reported. Sometimes they are taking number of medication, they are taking with the medication, monitoring effects of treatment, there are chances. Switching some route of administration over this dose when switching from IV to for oral. So, well, for pharmacists, after great studies, what they have recommended for pharmacists when there are certain error has to be raised, error has to be reported, or error has to be found or written over the monograph of that drugs, what they have to do. What they do? Participate in drug therapy monitorings. Wherever their drug is allowed or administers, they have to go there and check how the drugs are administered. Stay abreast of the current state of knowledge. So that's why I'm giving you latest knowledge, the most equipped with the latest knowledge of the drugs. Information and advice about therapeutic drug regimen and correct use of medication. They must have, and they also advise information because the pharmacists best know about the therapeutic drug regimens is their applications. So wherever they have to pass on any information, they must be familiar with the medication ordering system and drug distribution policies. Never assume or guess the intent of confusing medication orders. So when you confirm that this is the right drug, then you have to dispense. It's difficult for me that you are coming now and never assume or guess the intent of confusing orders. Pharmacists should maintain order lines and cleanliness in the work area and perform one procedure at a time. So you have to dispense once a drugs at one time. Review an original copy of the written medication order. Must see the original copy of medication order. Use of now what the use of automated devices is checked by manual or technological means. Now you have to apply the latest devices for dispensing. Dispense medication in ready to administer dosage forms whenever possible. Review the use of auxiliary labels also. Ensure that medications are delivered to the patient's care area in a timely fashion after receipt of orders according to the hospital policies and procedures. What they do, observes how medication are actually being used in patients' care areas to ensure that dispensing and storage procedures are followed. So during that, he has to monitor that how the drugs are dispensed, review medications that are returned to the department, review and provide advice on the content and design of pre-printed medication order forms or sheets. So last thing is that they must maintain the record in a pharmacy wherever they are working over there. Electronic prescribing may help to reduce the risk of prescribing errors resulting from illegible handwriting. So nowadays, mostly in good hospitals, they are prescribing on electric gadgets. They mostly computerized prescription are generated from inpatient wards to the pharmacy. Then computer generated and transacted transacted orders system eliminates complex issues of transfer of prescription and typographical problem. Effects of such system on patient's outcome remains understood. So that's why nowadays, mostly in good hospitals, they have computer-generated prescription, so it's easy for the pharmacist to read that instead of handwritten prescription they have to receive. Now the look-alike, sound-alike class is that. So what's a look-alike, sound-alike? Medication include medications that are visually the same in physical appearance or packaging, and name of medication that have similar spelling or similar phonetics. If they both have same, then it is a look-alikes. Include medications that are usually the same in physical appearance or packaging, and name of medication that have similar spelling or similar phonetic. What is the problem? As more medicines or new brands are being marketed, in addition to the thousands already available, many of these medication names may look or sound like confusing medications name, and similar products packaging may lead to potentially harmful medication errors. So that's why there is, if you have the Lassa drug, there are chances of potentially harmful error while dispensing. You can see these two drugs. The one is dexamethasone and then another adrenaline. Same packaging over there. Now, very careful when the person has to dispense. Now, the one on left side is heparin and there is a midazolam. Both are different drugs. You can see someone with heparin, there is a midazolam. Similarly, these two infusions are also different over there. So these are known as Lassa drugs. Further, we can see that look like and identified and stored separate. So must be separated. They cannot be placed in the same rack. Almost similar looking ampoules of injection on dock. It's known as on Citron. It is a antiemetic, mostly given in cancer patient. An injection, tramadol. Tramadol is an analgesic. It's on dock is manufactured by Limited with embossed printing in red color, whereas tramadol is manufactured by Pharma with embossed printing in red. So both are the same. There can be confusion that instead of someone has prescription of tramadol, instead you can give Ondoc. Ondoc has a different indication and tramadol have a different indication. Tramadol is for analgesic, synthetic narcotic, and onadistone is antiemetic, mostly prescribed in cancer patients. Then you can see our two drugs, ceftazidime and cefepime. Both are from Sandoz. Cefepime and I think cefepime is a fourth generation cephalosporin, and ceftazidime is a third generation cephalosporin. So see the level of same. There can be confusion while dispensing this. So take care. They may be separate in different separate racks over there. And you can have similar is too similar. Exact is that on the left side you can see gabapentin and gemfibrozole. Both are different molecules, different drugs. And right side is hydralazine and there is a hydroxyzine. Both have different indications. That's why while dispensing, the pharmacist or the technician take care. They have to fill according to the prescription. So they cannot be in place of gabapentin, they cannot dispense gemfibrozole. So that's why you must be take care while dispensing these drugs. So visiting a website for same is easy, but working on the same to keep record and put in the practice may difficult. Flood of medicines in pharmacy, how many will you? So that's why you have to carefully, you have to check these drugs similar. So before we are going to dispense, you can see these drugs are similar in shape, color over there. So that's why there can be a problem. There can be a problem that while we are going to dispense. You can see over there is sandostatin and this santosinone. Both have different indication. There's must continuance, the 60 mg and then 100 mg. There can be confusion while going to dispense these drugs. Similarly, you can read the name of that injection over the ampoules. There are chances that you can dispense the wrong drug. So again, there's sometimes brand names over there. There is a benzol, it's a danazole. There's a benzo, it is a albendazole. Both have different indications. Alprazole and atprazole. There can be alprazole is a omeprazole and alprazole is a alprazolam. Both have different indications. Amast is ampicillin and amset is a amlodipine. Both have different indication. Adcom have different. Telemistran is there. Adcon is fluconazole. Again, Alflox and alpha-oxacarbazepine. Both have different indications. Dazolic, it is ornidazole, and the dazolin, it is sertraline. So these all have different indications. So there can be confusion while you receive a prescription, and though you can dispense benzole instead of benzodiazole. So that's why while you have to check when you have to receive that stocks, you have to keep separately. You know these names, and your pharmacist must know. That's why we say that the pharmacist must supervise the dispensing of drugs in a pharmacy because he knows better about the indication of these drugs. So while he is going to dispense, he better read and then he has to dispense whether they have the same colors or same monogram over there. So if you read the prescription properly, he knows the generic names of these drugs, then he has to dispense according to indication. So sometimes he has to ask from the patient about his diagnosis or if check over the prescription, if it is a proper diagnosis is written over there, then he has to disregard. If the diagnosis say that if danazole is that, benazole is albendazole, albendazole is the, I think, helminthes, and danazole have different indications. If he has a helminthes, then he has to give albendazole. Similarly, there's omeprazole and atprazole, and there's alprazolam is alprazolam. So he has to check the diagnosis and then he has to dispense. There can be chances of that in generic. Ecomide is there, it's a furosemide, and equazide is a hydrochlor. Both are diuretics, antidiuretic. Sorry, both are diuretics, but they have different class of diuretic. There can be chances sometimes you can dispense equazide in place of ecomide. So there can be disprin, there can be dozapine. Both are same aspirin, but dozapine is entire coated, I think, 75 milligram, and disprin aspirin is a 350 milligram. Their code can be epitap and epiton. Both are, it is a phenobarbital and delphino. Both indication is same. They can be given in epilepsy, but both have different molecules. Then osteophyt, glucosamine and ostrobit, it is a calcium carbonate. Similar indication can be, but they have different molecules over this. Hormonal is mebendazole and hormonal is albendazole. Yes, indication can be same, but the molecule are different. Both are enthalpins, but there can be chances of medication errors. Furthermore, we can say that cefixime is there. The cefixime is there, and there's ciproflox. Both ciproflox antibacterial, cefixime is cephalosporin. They can act over there, but there are confusion over there. Then amoxicillin is there, atrox is there, roxithromycin is there. There's cefixime is there, cefpodoxime is there. There's cefuroxime is there, cefixime is there. Dapplin is there, sertraline is there, and there's dapnel, clomipramine. They can be used in depression, I think. Sertraline is there. So that's why there can be confusion, but they have to check when dispense these drugs. Again, these are hydralazine is there, hydroxyzine is there, gabapentin is there, gemfibrozole is there. So we have done this before that. Then profile. profile, thiuracil is there, colchicine is there. There can be chance, again you can say insulin is there, regular and now both are different. So there can be chances of confusion when you see these drugs. Then hydralazine is there, hydroxyzine is there. So there are chances of confusion while dispensing these drugs. A patient, now further we can say that again there is a various blunder has to be done. A patient will administer 18 units of insulin instead of prescribed 8 units. The patient requires emergency treatment and recovered. The prescription chart was unclear. The abbreviation U was used for a unit which was misread as a 0. So they have written 8U instead of they read 80. So that was very, very overdosed while dispensing to the patient. So at that time, someone has to check that 80 units cannot be given at the same time to a patient. A newly qualified staff nurse on a hospital ward administers a medication dobutamine to a patient via IVF when it was prescribed to be administered. The patient requires monitoring but was not found. So they have Bapar is not still. So again, another story is that a 78-year-old man with human immunodeficiency by HIV accessed our hospital and was brought to our attention in August for severe renal failure. That he had been taking highly active antiretroviral therapy with lamotidine, abovegavir, and fosamatinib since 2006. Due to an augmentation in creatinine plasma level, the reduction in lamivudine dosage 100 milligram day and friction of reservoir day became necessary. Unfortunately, the patient took both lamivudine and abacavir. Therefore, the cessation of the two medications lead to asthenia and acute renal failure within a few days. This case emphasizes the importance about how physicians must pay very careful attention during drug prescription, most particularly as far as adult patients are concerned. In fact, communication, improvement, nutrition, and patient can prevent. So that's why the pharmacist must check the prescription when he receives over there. So cannot give such drugs, so it can become hazards. A Pittsburgh pharmacist mistranscribes a telephone prescription which calls for 2.25 microgram raw calcium pills 4 times per day, confusing milligrams and micrograms. She writes down 2.5 milligram pills 4 times per day. The patient receives a dosage more than 2,000 times the recommended maximum. He is now totally disabled, suffering from complex partial seizure. The jury awarded him 8 million in the compensatory damage. A product which pharmacist dispenses cysteine, a female hormone, instead of comedine prescribed. The patient takes the wrong drug for 11 days before his wife discovers error. 2 days later, he suffers a stroke and subsequently a heart attack in a coma. He now resides in a special care facility. The drugstore chain insurance company agrees to pay 6 million to settle the lawsuit. And South Carolina pharmacist dispenses Glanase 6 milligram instead of the Ritalin prescribed. Patient, a 7-year-old girl, in just 16 times the recommended Glanase starting dose for adults diabetes patient. She suffers permanent brain damage and is mentally retarded. The jury awarded 60 million to care for the child and to punish the drugstore chain. This error. There are few research works has been reported in literature about the error We have to think how strong and robust are our reporting system, how, whom, when, and where. Information technology benefits barrier computerized or electronic medical records, provides patient information to guide drug selection and regimen, not widely available or used, reduces errors related to orders, transcription systems may be incompatible outside an organization or institute, reduces errors related to use of abbreviations and name confusion. So further computerized providers order entry legible prescription, patient data, not up to date, integrates drug formularies, provides clinical decisions, making support with alerts and reminders as prescribers enters an order, high cost of implementation. Double checks and orders before it goes forward, not widely available, assist with the converting oral or RV doses of prescribing. Now, automated prospective drugs utilization review system. So nowadays, automated prescriptions are generated. Technology benefits barrier automated dispensing devices. Unit holds medication at a specific location and allows dispensing only to a specific patient, not linked with the barcoding and electronic information system. Helps to assess the full range of medications patient is receiving. No communication with the prescriber, assesses drug allergies, doesn't fully assess potential interactions because of limited data and identifies inappropriate drug therapy, averting hospitalization resulting from an adverse drug event if specific to patient. The stalking errors user's key is necessary for access. User input errors pharmacy review is part of a process of dispensing. So that's why it has to be used. Information technology benefits, barriers, physical packaging, changes, appearance of medications to avoid errors associated with similar looking or similar spelled drugs, cost of repackaging, maybe uses only one name and one look for each drug or uses standardized labels. New packaging may not be in stock, it's not mandated. So what we have to change of that? The barcoding automated record of medication administration to specific patients, check regulatory status, administration on most drugs used in dispensing, and verification process cost of scanner maybe counters the misreading of drug names and dosage can introduce human error by requiring manual loading of equipment and barcodes verification. They have to limit it and scanner barcode packaging change needed for barcodes on unit doses problematic for doses such as half a tablet administered.